This conference will now be recorded.
Hello, friends. It's Jody with Wellspring Solutions. Thanks so much for joining me. In my last video, I talked about some basic tips to better communication, and we're going to be talking today about applying those to dementia care. And individuals with dementia experience changes and challenges with their communication, and the loss of those skills advance as the disease progresses. Conversation and simple tasks can become frustrating for both the person with dementia and their caregiver, but it's our caregiver's job to be the one to provide comfort and reassurance during these times. And nonverbal communication with your loved one or the person that you're taking care of with dementia, such as a touch or a warm smile, becomes very important and all that more meaningful. But before I continue, I want to share with you the services that we offer through Wellspring Solutions related to dementia and helping those in the community. And if you have any questions about what services might benefit you the most, please contact our navigator or visit our website for more information on all the services that you see offered here. But let's go ahead and go to talking about the changes in the ability to communicate. And they vary. They're based on the person and what stage he or she is in the disease process. But changes that you can expect to see throughout the progression of the disease include repeating oneself, using familiar words repeatedly, describing a familiar object rather than calling them by name. So someone may substitute saying the thing you sit on as opposed to calling it a chair. Speaking less often, and then relying on gestures more as a result of that. So as we go back to the basics that I talked about in my last video, just briefly, being clear and concise and assertive, and being aware of your body language and your tone, actively listening, and showing empathy and respect. So as we apply those to loved ones with dementia, we're talking about our words, having simple messages, being aware of speed and clarity. And you can be assertive, for example, but still have a friendly, warm approach, perhaps saying, let's get ready for the day versus would you like to get up now and get dressed? So you're expressing yourself, you're not speaking aggressively, but you are also setting the stage for we're going to get up now. Using our body language, having welcome body language, open and relaxed, and it should be in tune to your words. So if you say one thing, but your body language says something else, the person with dementia can certainly experience distress. Our tone, of course, communicates what we're feeling, regardless of the actual words we're saying. So we need to be aware of our tone, having it be calm, even, and kind. And our presence, actively listening. When you practice active listening, you make the other person feel heard and valued, and it's a way to build empathy. And our treatment, we should always promote dignity and respect and positivity. And while it's not always easy to be patient with someone that we're taking care of or a loved one, we want to strive to treat the person with patience. So let's go ahead and look at these a little bit further. So our words. We want to, again, speak slowly and clearly. We want to use simple words and sentences. It's okay to repeat information or questions as needed because it certainly could take longer than you might expect for the person to process what you are asking them. So it's good to repeat it in the same way so that they don't all of a sudden turn back the clock and have to start reevaluating and processing a new message. You want to avoid slang and vague statements. One example might be saying, it's time for your bath, go hop in the tub. That's not a concrete statement to say just hop in the tub. That can sound confusing. And discussing, one topic at a time and not overwhelming the person. So here are some examples and some tips. Providing the solution rather than asking the question. So saying the bathroom is right here instead of asking, do you need to use the bathroom? Providing positivity. Please do this instead of don't do this. Okay, that makes sense because we want someone to feel like they're being successful. And when you tell someone over, don't do that, don't go this way, you get a sense that you're being scolded. And limiting the number of choices. So instead of saying, what would you like to drink this morning? You might say, would you like tea or coffee? And of course, knowing what the person you care for's preference is always helps. And using the names of people, places, and things instead of pronouns. So again, being clear with your communication. Here is your hat, as opposed to here it is. So your loved one with dementia will notice your expressions, gestures, and moods, even when they can't understand your speech. So they will pick up on your emotions, body language, and tone. So let's look at some tips here. Don't stand too close to someone or stand over them to communicate. It can feel, intimidating. So don't stand too close. Respect the person's personal space, and this will help the person to feel more in control of the situation. Again, making sure your expressions and body language follow suit. Your body language will be read, so sudden shifting or movements or a tense facial expression may cause distress and just can make communication more difficult. Using gestures to reinforce a message, so you might want to point to an item, for example. And if their words or their body language show they're comfortable, you might want to hold their hand or give them a hug. So you want to respect boundaries and be respectful of their body language cues. But again, don't underestimate the reassurance you can give by simply patting someone's hand or putting your arm around them if it feels right. And being aware of our tone, using a gentle, reassuring, and relaxed tone. Because someone who has even impaired communication skills can understand tone. Something that's said with a kind tone is understood quite a bit differently than something that's said with a harsh tone. So reassuring, relaxed, and a lower pitch is also more calming. So let's talk about our presence. Actively listening, taking the time to listen, again, patiently waiting for a response, not folding our arms, looking as though we're irritated or frustrated or aggravated that the person has not responded yet. We don't want to interrupt or rush the person. Want to minimize distractions. These are all factors of active listening. And it really just means being present. And it can be such a gift to just be present with your loved one or the person you're caring for. I mean, they can't remember half the time what happened before. They don't know what's going to happen in the next minute. So how they feel right now is really the most important thing to pay attention to. And if it is appropriate, you can even repeat what you heard back to the person to see that you understand their message. So as we turn to our treatment, the most important thing is to really be thinking about the person's feelings. The goal to always keep in mind is to promote dignity, positivity, and safety, to be accepting instead of contradicting, instead of correcting or arguing, looking for opportunities to agree. Because I'm sure that if you've had experience trying to rationalize or, explain why something just doesn't make sense to someone with dementia, you both are going to end up feeling very frustrated. The outcome is not going to be positive if you argue. So you want to reassure, you want to validate. I know there are times when I've heard from caregivers that their loved one has accused them of theft or stealing from them, which is very disheartening, and it can hurt your feelings. Remembering again, it's the dementia that's talking, but if able, instead of telling someone that that type of accusation is ridiculous, you can try and turn that into a validating statement. Perhaps saying, I would also be very upset if I thought someone was stealing from me, and try to redirect at that point. And you never want to talk about the person as if he or she wasn't there. It doesn't feel good to anyone to not feel included. So you certainly don't want to ignore the person, bring them into the conversation, and don't talk down to the person, or use baby talk. That's just, that's insulting, and that is not a way to better communication. So just some additional tips for when you're providing care. No one method is potentially going to work all the time, and no one strategy works all the time with the same person. But you want to approach the person from the front, identify yourself, and call the person by name as well. It can help orient the person and get his or her attention. And you certainly don't want to startle the person. And you also want to keep in mind to be very aware of the person you're caring for's limitations. So if they have hearing and vision issues, that will affect the success of your communication. Breaking each task into steps, and in a reassuring voice explaining each step before you do so. Again, just keeping things simple. You might want to help demonstrate the task, again, using a gesture, point, or touch the item you want the individual to use, or begin the task for the person. Again, allowing plenty of time for a response, and finding ways to have them assist and be independent to their ability in the process, so ways that they can take care of themselves with your assistance. Use body language to guide the person, an arm around a shoulder, a hand outstretched in invitation, but ask or tell before touching. And again, hopefully you will know the person you're caring for well, and you will know what they are comfortable with. And again, providing simple choices. So again, if you want to ask someone if they would prefer the red sweater over the blue sweater versus what would you like to wear this morning. Okay. One other part that's quite important is to watch for unspoken communication. And we could do a whole talk just on this very topic, because when someone is not able to express their needs, their discomfort to you, they may express those in different ways through yelling out or striking out, and they are in distress. So it's very important to be thinking about what caused this type of behavior, the yelling out, the striking out. Is the person uncomfortable? Are they in pain? Do they need to use the restroom? So just being aware of what the unspoken communication may mean is very important. So just in summary, again, it's our job really to be the ones to communicate comfort, to communicate reassurance, and to think about our words and our body language and our tone and our presence and our treatment when we are working with someone who has dementia to better communicate. Thank you so much again for joining me.